Researchers collected stem cells from people with different racial and gender backgrounds and then grew these organoids, or small functioning organs, in petri dishes. Here you can see some tiny breathing lungs. Federal data show coronavirus disproportionately impacts people of color and men, says UC San Diego neonatologist Sandra Leibel.
What they're finding is the patients that are the sickest, there's this lung disease that patients end up on the ventilator, and it's called ARDS. And those patients that end up with ARDS and get really sick and need hospitalization as well as ventilator support are people that come from various ethnic backgrounds, mainly Latino and African American as well. And that's why we want to use our mini lungs in order to understand why this is happening.
Sanford Burnham Prebys Medical Discovery Institute biologist Evan Snyder says they are exposing the mini lungs to coronavirus and a number of promising antiviral drugs. That's not only to show biologically why the disparity exists, but also whether certain antivirals could be tweaked to help different people more effectively.
If we validated these drugs in a clinically relevant system and we saw a difference, we could just compensate for that by changing dose or dosing regime, so that anything that we discovered should be applicable to all patients across the board.
Researchers say they are now collecting the data and are also planning to look at how the virus may impact mini brains. Shalina Chatlani, KPBS News.